and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Rate and review the show at kevinmd.com/rate. Subscribe at kevinmd.com/follow. Today in the show, we have Miriam Pervez. She is an anthropologist and she wrote the Kevin MD article, Listening to the Doctor's Heart. Miriam, welcome to the show.
Thank you for having me.
So we'll get into your article in a little bit, but first off, can you share your story and journey to where you are today?
Yeah. So I suppose for as long as I can remember, I've been interested in science, but also sort of human stories. And I think anthropology as a major really spoke to me in college. And so I picked that, stuck with it. And I think specifically, I wasn't looking, hyper-focusing on cultural or social anthropology. What really spoke to me was medical anthropology and sort of telling those human stories in healthcare. One of my heroes is Dr. Paul Farmer, who is a physician, who was a physician and a medical anthropologist, and people like that really spoke to me and sort of channeled that journey for me. And so when I was sort of looking into what to write for my thesis in undergrad, I was looking in all those elements of patient care. What does that mean? How do we sort of humanize healthcare for patients and people? And so I looked, first at home. I looked at Karachi in Pakistan, and I saw that one of the big teaching hospitals here had invited Dr. Patch Adams, who is an American physician, but, a very unique physician. And he likes to, take that extra time with patients. He likes hour-long, meetings instead of 15-minute meetings, and they invited him in, and I sort of went to them and I said, well, what inspired you to do that? They really wanted to talk about, humanizing healthcare and what that means to them. And so through that, I was able to sort of channel what I wanted to write about and think about. And I got on board with them just on their first they had a play therapy pilot program. So they were assessing the sort of psychosocial needs of pediatric patients through, a child's language, through that language of play. And for using that for pain management, using that for all sorts of things. So I sort of got to be a participant observer in that experience and talk to them, the clinical psychologists who were running that, and just see them at work with the patients and their families, and really understand what those needs were and how they were highlighted for the pediatric patients. And now I've sort of continued that journey, and I've sort of now for my master's thesis, I'm doing somewhat of a comparison between the US and Pakistan and seeing what sort of both sides see as the psychosocial care needs of pediatric patients, which sort of leads me to the article, because I found that one of the unexpected byproducts of this journey, I sought out to sort of understand the psychosocial needs of pediatric patients, and I came away learning more about the physicians,
Sure.
So that was fascinating for me.
Yeah, so let's talk about that article. It's titled Listening to the Doctor's Heart. Now, for those who didn't get a chance to read your article, can you just walk my audience through it and share the story of why you decided to write it?
Yeah, so I think, so I've worked with someone very special, Dr. Suzanne Coven, and she always says, you write when you have a sense of, there's an unstable moment. And I think that sort of came to me when I was doing this research, that I found that more than the physicians relaying what the needs of the patients were, they're talking about themselves and their journey. And I felt very grateful and special to have been sort of, to be able to experience that and to be that safe sounding board for all of them. And this was, peak pandemic, burnout rates are high. And it was a topic of discussion, and to be in a way at, like in, center stage and just see that from the front lines, that was very eye-opening and just really, it intrigued me. And I just wanted to sort of write about my experience and see, maybe explore why, someone would talk to an anthropology student, about that and why that need arose in them and what that means to me, what that means for the future of physicians and such. And so I talk about, yes, there's burnout, and yes, it's been sort of exacerbated by the pandemic, but there is a need for doctors in general to sort of unpack their work, and they don't
Mhm.
necessarily take that home, and many hospitals do provide, lots of different types of ways to combat that. They have groups, but they don't seem to be working, or maybe, we haven't invested enough of our resources in that. And so I just found that, these wonderful healthcare professionals felt safe opening up to a third party person
Mhm.
who was just, a sounding board for them, and hopefully provided some comfort. But I think that sort of just made me think about, well, what if we had such systems in place where someone totally removed from their work or family, is listening to them or just letting them, you know, speak freely. So yeah, so I think just listening to the doctor's heart after they've listened to yours, is just a really interesting way to look at it.
So tell me about some of the stories that these clinicians have told you.
So there was one gentleman, I hadn't met him ever before. Of course, this was, a new field for me. I've been branching out, looking at healthcare professionals from all over in Pakistan, and hadn't met anyone before, just been cold calling people.
Mhm.
And one of them, spoke about a dialysis patient, he had, and it's a young child who required a transplant, and there was no match, in the family, and it was proving to be a very tough sort of situation. And when they finally did find a match, it was wonderful, except that the child was extremely scared
Mhm.
and would not want to go through the process. And he found himself just, very conflicted, because the parents had sort of given up. They said, all right, we didn't think she had long to live anyways.
Mhm.
It's all right. We can't do this. So let's just take her home and forget about it. Like it's, and he just had that really, moment where he said that, how can I just let this child pass away? Like how can that just happen? And so he worked really hard with, he found a friend who was a psychologist,
Mhm.
and he just said, how can we sort of work together to make her feel comfortable with the hospital, with me, and so many things. And this is a story he hasn't told, anyone, and he just shared that with me. And he was moved to tears, at the thought of someone dying on his watch.
Mhm.
But he was able to sort of change that for her, and he saw that difference that he made. And just, something that powerful, or people telling me, were young junior doctors working in the NICU for the first time, seeing, a very, very, like an infant, breathe their last breath. And that's something that takes a toll on you, but you have to move on. You have to continue with the rest of your day. Something like that happens at 8 a.m. You can't go home. You can't tell anyone. You can't even stress your older colleagues, your younger colleagues. You just have to move on. And so, yeah, just many powerful stories like that.
So tell me about that intersection between medicine and anthropology.
Mhm.
How can some people with a background in anthropology, how can that make them better physicians?
Yeah, I think, well, if you look at the example of someone like Dr. Paul Farmer, and his team and Partners in Health, I think they're really great examples at sort of, understanding not just, say, structural elements. We know what's wrong with the healthcare system. We know even structural elements of an individual. We may know what's wrong with the body, and we're trying to fix the body,
Mhm.
but we are trying to sort of understand the individual as well as the, social surroundings, even maybe up to the political level, but understanding and looking at it more holistically,
Mhm.
and seeing a person as a product of society and as an individual, and just understanding them, seeing where they're coming from and their story. That, that's when the real healing begins,
Mhm.
and that's when you can make a difference. And I mean, you can give someone medicine, but if you watch his brilliant film Bending the Arc, you can give them medicine, but if you don't have someone to encourage them to take it, what will that do?
Mhm.
you know and to have people they trust tell them to do things, and for them to see a result, and for you to work closely with someone, that makes all the difference.
So you talked to so many medical professionals in Pakistan and they shared their story with you. What would you say are some of the biggest surprises you had after listening to all these stories from these medical professionals in Pakistan?
Yeah, I think in Pakistan and just and also just reading so much online about the greater global community, just
Hmm.
experiencing so much of this burnout, not just, and we can't just attribute it to the pandemic. I think it's also highlighted a lot of the cracks in the system in general, that's just been exacerbated by the pandemic. I think
Hmm.
how sort of maybe the healthcare professional is failing the healthcare professionals, right?
Hmm.
I think that's a really tough one. And I think, someplace like here, we are a resource poor country. That is true. And our sort of main push is to provide, as they told me, we focus more on, getting people medicine, getting people treated. The psychosocial needs are very low priority on our list, and where they are a priority in bigger teaching hospitals, maybe they're not given that much importance as they should have, you know and so I think su- surprisingly, we're all in the same boat, perhaps, is
Hmm.
the main takeaway, which seems funny, but it's true. Where some may lack those psychosocial resources, not just for patients, but for physicians, for older patients, some may lack them and some may have them, but they may not be working, you know. So yeah, that's sort of something that I've taken away.
We're talking to Mariam Parvez. She is an anthropologist and she wrote the Kevin MD article, Listening to the Doctor's Heart. Through your lens as an anthropologist, are there any takeaways or pieces of advice that you could give to clinicians? Because obviously, as an anthropologist, you are heavily invested in human stories. So, through that lens, give us some advice on how we as physicians can better connect with that patient in front of us in the exam room.
I think one of the things that I've learned looking from both sides is probably your fears and doubts are probably as valid as those of your
Mm.
patients, And I think that's important to reflect on. And I think, we on the side of the, healthcare professional side, we sort of see ourselves as focused, detached. This is our job. Patients, we see them as vulnerable, you know. But I think, like I said, we're sort of all in the same boat. But I think in many ways. And I think what's most important, looking through that sort of human lens and thinking about humanizing healthcare, we do need to share our stories. We do need to sort of find those safe spaces. And I touch upon this in the article. I think that element of that third party objective person was so important to, establishing those relationships for me, that I wonder if there's any way we can sort of curate that in the world, not just maybe hotlines, but maybe some sort of volunteer service. You talk to physicians
Hmm.
about why they joined, why they stayed in it, why they did what's not working now, So I think just unpacking that and creating those safe spaces is very important. And it starts with, feeling comfortable to share and sharing with each other and then sharing beyond. And that essentially, once you've sort of humanized healthcare for the professionals, we can definitely try to humanize it for the patients as well.
And my final question, what are some of your take home messages that you want to leave with the Kevin MD audience?
I think just, we are all human. And I
Hmm.
think, if anything, the pandemic has brought us closer together in many ways, which is important. And we should, reflect on that, and we should work towards creating those safer spaces for ourselves and those among us, and to know that it's okay to be vulnerable, and that in many ways is your strength, not your weakness.
Well, thank you so much for sharing your stories, time, and insight. And thanks again for being on the show.